Yes, doctor. I will give 12 minutes and your time starts now.
Hello, I'm Dr. Abdu, one of the doctor of the clinic today. Just to confirm, am I talking to Mr. Watson, 40 years old?
Yes, doctor.
Nice to meet you, Mr. Watson. Mr. Watson, how are you feeling today?
Well, doctor, I was having so much breathlessness. I was about to die last night. I don't know what happened. And you brought me to hospital. You guys treated me so well. I'm much better now. Thank God.
Okay, it's nice to know that you're feeling better. So, Mr. Watson, before I go ahead regarding your health condition, I just want to know, do you want anyone else to, during our conversation, for your support?
No, thanks.
Okay. Uh, do you want anyone? Okay, sorry. Do you have any specific expectation from our meeting today?
Doctor, I was eating something food and suddenly
Mhm.
developed breathless so much. I'm so worried. It happened I was so near death. What happened exactly? I'm so afraid.
Okay, Mr. Watson, I'm really sorry to hear what happened to you. I would help you in every ways that is possible. Okay, so
Yes.
before I go ahead, I would like to explain you what exactly happened to you. Okay, so the
Okay.
symptoms which you mentioned is due to a condition called anaphylactic reaction. Do you have any idea what it is?
No, doctor. What is that?
Okay, so basically it happens because of allergic reaction. And in your case, you're allergic to a food called peanut.
Oh,
Are you
yes,
with me,
doctor.
Mr.
I
Watson?
ate peanut. Last night I ate peanut.
Okay. So peanut is you're allergic to this peanut, and it's a food allergy where your body's immune system reacts unusually to specific food. And sometimes it can be mild, but in your case, it happened it became serious and it became life threatening. However, we treated you, promptly, and you're better now. That's a good news. So, do you want to know the symptoms, other symptoms of it?
Yes, please, doctor. Tell me all.
Okay, so since you're allergic to these peanuts, if after consuming it or any other product that contains peanut, you can have certain symptoms that could be, red, itchy red kind of rash in your body, and swelling of your face, your mouth, your lips, and you can feel, sick, and you can have difficulty in breathing, as in your case you mentioned. You can even have dizziness. Okay, you can have difficulty of swallowing, even your voice change might happen. Okay, and even
Okay.
tummy aches. These are certain symptoms. Okay, so I'm just telling
Oh,
you about the symptom, not to worry you. It's just to keep you informed. Is that okay with you?
yes, doctor.
Okay, so Mr. Watson, for now, do you have any concern?
No, doctor, you mean that this peanut has caused this all problem? I thought that my asthma has become worse because, I'm asthmatic and for that I'm taking my medicine regularly. But this
Yes.
happened last time. Last night I was so afraid that why this happened to me, doctor?
Yes, Mr. Watson, you're very much right, and I'm totally informed about your condition, that is asthma. And however, this asthma is not the cause in your case right now. This reaction which happened is likely due to peanut allergy. Okay. So you don't
Okay.
have to worry. We will talk more about it in details, like how you can prevent it and, what you can do in case if you get an attack, okay, later. Okay.
Okay.
So right now, I would like to tell you is that I told you about the symptoms. So anytime if you notice such kind of symptoms, and the what you have to do is you have to emergently inform everyone around you, and also we will give you something called EpiPen, so that you can inject it yourself, and you can prevent further devastating condition. Okay, and also
Oh,
immediately get hospitalized, you have to contact us.
right.
Okay. And this peanut, apart from peanut, you can be even allergic to other foods also. So you have to be very careful and cautious while eating, and you have to realize what food is causing you this kind of symptoms. For now, we have realized it's peanut, and we would ask you to avoid peanut, if possible. And you have to also see, while you're buying food, you have to see what are the contents of those food. Sometimes you can have peanut in different kind of packaged items, so while buying you have to be very careful. And also in restaurants, when you go for eating, you have to ask the chef if any peanut is used or not in those kind of food. Are
Okay,
you?
doctor, but if I don't eat peanut,
Mhm.
even the smell can cause this?
Smell, it's very less likely. However, yes, it can. Okay, but it's more of eating that this kind of devastating reaction happens.
Oh, doctor,
Okay.
but I work as a chef, and daily
Mm-hmm.
we are dealing with such nuts, and I love my
Mm-hmm.
profession, doctor.
Oh, I'm really sorry to hear about it, Mr. Watson. And I have to tell you that I have to be honest with you in this case that continuing your job as a chef will be dangerous to you, will be life threatening to you.
But
So I
doctor,
would
I
advise.
I love my I love my profession as chef. I can't leave it, doctor.
Yes, Mr. Watson, I can understand what you're going through right now and where these thoughts are coming from. However, continuing your job as a chef can be, more harmful to you. In sense, it can cause you life-threatening condition because you're having allergic to this peanut. Even the smell can cause it, but it is more of eating. But yeah, even smell can, cause this kind of symptoms. So I'm sure you love your life, and we all are bothered about your life. And for your better interest of your health, we are advising you that it's better you change your profession, and we'll talk to the occupational health physician. He can help you in this regard.
Okay,
Okay.
doctor, but
And
I request you, please don't inform my manager. Otherwise, he will sue me from the job.
um, Mr. Watson, I appreciate your concern. But however, I would love to tell you that we will not inform your manager, but we would advise you to inform your manager so that in case if you do get an attack in your workplace, he can help you. The more people you inform, the more people can help you in case of emergency. Okay.
Okay,
So it
okay,
would
doctor.
be advisable if you inform him. Okay. And regarding suing, we will talk to the occupational health physician. He can put you into some other department where you don't have to get the taste or smell of the peanut. Okay.
Right. Yes, that's better.
And okay. And regarding the asthma, which you asked me, asthma is it is not because of asthma you got this condition. However, people who has asthma, are more likely to get this kind of allergic reaction. There's a link with it. Okay. However, don't
Okay,
worry. We will keep you in under regular follow up. We will talk to our asthma doctor also. He will also keep you in regular follow up. And
okay,
regarding the treatment, I would like to come into it is that you have to avoid this kind of food. That is the most important treatment. Other than that, in case if the symptoms I have mentioned to you, if you develop any of these, then we will provide you with the EpiPen. You have to inject it yourself. It is very auto injectable. Okay. You don't have to get scared. You just have to inject. Okay. And if possible, we will provide you with a lot of EpiPen. You can even give it to your parents or your family members, so in case of emergency, even they can help you with it. Okay. And we will also, provide you with leaflets and brochures so that you can understand more about your disease.
okay.
And till now, do you have any concern?
No.
Okay. If you don't mind, I have certain checklist question. Can I ask you about it?
Okay.
So I just want to know that do you smoke?
No, doctor, I was smoking, but after this asthma diagnosis, I quit.
Okay, it's nice to know. How about drinking alcohol? Do you drink alcohol?
No.
Okay. And how is the symptom affecting your asthma, or this allergic effect has affected your daily life as well as your job?
Yes, well, doctor, this asthma is too much problem for me, but I'm controlling it with medicines regularly. Doctor, can this reaction which you told can develop in my children also?
Okay. I would like to tell you is that this is not a familial condition. It does not run in family, and your children is likely to develop this condition just like any other people in general population.
Okay.
Okay.
But they are more,
Um,
they tell the patient they have higher chance to develop as compared to the normal population. Okay. But it is not a familial condition. Good.
okay. So right now, do you have any concern for now?
No.
Okay. Do you need any kind of social or financial help from us?
No, doctor. My wife is very caring.
Okay, that's nice to know. So, right now, if you don't mind, can you summarize to me what we have spoke today?
Yes, doctor, you told me that last night I developed this fatal attack, which was life-threatening. It is because of the allergic reaction to the peanuts, and for that I need to avoid peanuts, and you will change my department, being